In this video, we're going to go over how to fix sacroiliac pain for good. Stay tuned. Hey everyone, Dr. Rowe here at SpineCare in St. Joseph, Michigan. So if you're dealing with sacroiliac joint or SI joint pain and need some quick relief, this is a video that you're not going to want to miss. I'm going to split it up into two parts. The first part is going to focus on mobilizing the joint and getting it loosened up, hopefully giving you very quick SI joint pain relief, maybe in as little as 30 seconds. The second part, we're going to focus on strengthening the area around the sacroiliac joint. That's very important. Think of it as strengthening your support system around the pelvis, the hips, the low back. It's going to offer a lot of benefits, including being able to do more throughout the day with less SI joint pain. So definitely don't miss that part. The great part about these stretches and exercises, you don't need any special equipment and they can be done in the comfort of your own home. So let's get started with them and get those sacroiliac joints feeling a lot better. With the first part, we're going to focus on mobilizing or releasing the SI joint. I usually recommend doing these right in bed. If you feel more comfortable on the floor, you're more than welcome to do that. So what I'm going to do first is a very easy SI joint release. I'm going to bring the legs up like this at 90 degrees. So my knees should be at a 90-degree angle. I'm going to take my hands and I'm going to place them on the outside of the knees. The movement with this is I'm going to try to drive the knees outwards into my hands while I resist against them. So just like this. You're kind of seeing that I'm pressing into them right there. And with this, if you do get a quick pop or release into the SI joint, completely normal. That's the whole point. It's trying to take pressure very quickly out of those joints. It's just gas being released. So what I like to do is just this exercise right here. Hold it for about 5 seconds, relax, and then repeat 5 times. So for the second part of this exercise, what we're going to do is go back to that starting position. We're going to take our hands and put them together like this. Put them inside the knees. We're going to do the opposite now. We're going to drive those knees inwards and resist against it with our hands. Again, 5-second holds, relax, and then repeat that up to 5 times. A note with all of these, if you do start to feel discomfort, please discontinue immediately. These should not cause any more discomfort. So with the next SI joint pain relief exercise, we're going to do a bicycling or scissor kick like this. What I'm going to do is I'm going to grab at the knee on one side, and then the hand on the other side is going to go at the top of the knee. What I'm trying to do is pull away with one leg and bring the other one towards me at the same time. But I'm going to just simply resist those movements, and I'm going to alternate between the two. When I do this, I try to hold it for about 2 to 3 seconds, relax, switch to the other side, and do the same thing. Try to do 10 repetitions of this, take a breather, and then do it one more time. Since sacroiliac joint pain tends to be more one-sided, this is a very good way to mobilize or reset a particular side. What I'm going to do is I'm going to go towards the edge of my bed. I'm then going to just simply let the legs fall off. From there, whatever side that you're looking to mobilize, we're going to bring that leg back up to that 45-degree angle that we did earlier. What I'm going to do then is I'm going to take the foot and turn it inwards. What I want to do next is try to take this knee to my opposite shoulder, almost like in a nice 45-degree angle. But I'm going to take the hand on the opposite side and place it on the inside of the knee. So when I try to go in that nice 45-degree angle, I'm resisting against it. And I tell you what, this is a great SI joint opener. Hold this for about 5 to 10 seconds, relax, and then repeat that up to 5 times, only to your comfort level. Again, you might get a pop or crack sensation into that SI joint. You can also do this on the other side. I'd actually recommend it. That way you're keeping both in balance. So with the second part, we're going to focus on strengthening exercises that are going to target the pelvic floor, around the hips, the low back, to build more stability into the SI joints. That should help decrease the frequency of that pain. I'm going to start on all fours. We're going to do a one-legged bird dog. If you're familiar with that yoga pose, it's a great one. And what I'm going to do is just lift one leg up just like this. And I'm going to hold that for about 5 seconds. I'm just going to then slowly bring it back down, and then I'm going to alternate to the other side. When you do this, you want to make sure to do both sides, not only the side that hurts. because at that point we're going to keep the muscles balanced, and that is very, very important because an imbalance is what generally causes sacroiliac dysfunction. So I like to do this about 10 to 15 times on each side. Take a little bit of a breather and then do one more set for good measure. For the next strengthening exercise, we're going to focus on the basic bridge. This is a fantastic exercise. If you're looking for one just to maintain pelvic and low back health, this is it. What you want to do is lay flat on your back, and what you're going to do is simply just lift the butt up off the bed or off the floor. You almost want to get your knees to your hips to your shoulders in a nice straight line, so you're creating a bridge. You should feel the abs contracting. You should feel the glutes or buttocks contracting, the low back start to tighten up a little bit. It's really giving it a good workout. What you then do is take a little bit of a breather and then just keep repeating that up to 5 repetitions. This is a good general back exercise that you can do a couple times a week just to help maintain your pelvic and lower back health. So give these a try. I hope that they really do help and make a difference. If you liked the video and got a lot of relief, please show us your support by giving this video a like and maybe subscribing to our channel too. If you have any comments or questions, please leave them below. I'll get back to you as soon as I can. Thank you for watching.